There's been a real revolution in our understanding of cardiovascular risk in patients with diabetes. For many years, as cardiologists, I'd say also perhaps endocrinologists, and as trialists, we focused on myocardial infarction as the key endpoint in cardiovascular outcome trials of diabetic patients. What has become clear now through the years, with perhaps the first real signal of this coming out of SAVOR-TIMI 53, is that heart failure is at least as important an endpoint as myocardial infarction in people with diabetes. In fact, there's heart failure with reduced ejection fraction, heart failure with preserved ejection fraction, asymptomatic patients who have elevated BNP, for example, who are at risk for developing heart failure. So a lot of evident heart failure if you look for it clinically, and then if you look for it biochemically, an even greater amount. Not that I'm suggesting just doing that outside of research purposes, but still lots of heart failure in the diabetic patient population. And what this has spawned now is a whole series of trials seeing if different drugs approved and indicated for diabetes can also reduce heart failure risk in people with diabetes. And for that matter, there are even some trials seeing if these type of drugs can reduce heart failure in people without diabetes. So I think it's a really great intersection of the diabetes world and the cardiology world that should lead to greatly improved care of patients with diabetes.